Welcome to Here to Serve, a United Regional podcast. I'm your host, Ryan Graves. My favorite part of being the Director of Patient Experience at United Regional is the incredible people that I meet and work with on a daily basis, and I want you to meet them too. Join us to meet the people behind the badge and to highlight those who are here to serve. Dr. Reddy, welcome to Here to Serve. We're glad to have you.
Thank you, Ryan. Thank you for having me here.
Yeah, it's an honor. So tell me, what I know about you is that your name is Dr. Reddy and that you're an oncologist.
Yes.
Tell me exactly what your role and title is.
Yeah. I'm a medical oncologist and hematologist. Basically, I'll be treating blood disorders and the cancers. The blood disorders including benign hematology, means like anemia, low platelet count, low white cell count, and blood cancers. Also, medical oncology including all the cancers of different parts of the body. That
Okay.
includes that's my job responsibility.
Wow. So not much.
Not
So
much.
So you are somebody that I've not gotten to sit down and talk face to face with. I've met you a few times.
Yes.
You've been in the community for a long time. You have a great reputation. Everybody that I know speaks so highly of you. So I've been very excited to get to pick your brain a little bit. I've got
Thank you.
lots of questions and curiosities. I'm a nurse, and so
Yes,
I know enough to be dangerous. Nurses are the worst sometimes, and so I got lots of interesting things I want to know about. But most importantly, I want to know a little bit about you today.
Yeah.
How long have you been in the Wichita Falls area?
21 years.
21 years.
Yes.
Okay, where were you before that?
Shreveport, Louisiana. That's where I did my internal medicine residency and medical hematology and oncology fellowship there.
Okay, so Shreveport, then Wichita Falls.
Wichita Falls.
Now, what about where before Shreveport?
Before Shreveport, I was in UT San Antonio. I was doing a research in the breast cancer. And before that, I was in India. That's where I went to my medical school.
Okay, now is that where you're from?
Yes,
India?
I'm from India.
So how long have you been in America?
I came here in 1995, almost 30 years.
30 years.
30 years.
So one of the things I was curious about you is, as a young man, as little Dr. Reddy, did you always know you wanted to be a physician? Or was it something different?
Honestly, I never thought about being a physician. In India, we go to medical school after 12th grade. And my dad filled up the application. He told me, apply for medical schools. I just applied, that's it. I never had any intention to be a physician, but it's my dad and my mom, they told me, be a good doctor. And so that's how it happened.
Yeah, that's incredible. Mom and
Yeah.
Dad said, hey, this is the path for you.
I just followed the path, that's it.
Yeah. Now, is that common?
It used to be common,
Yeah.
but of late, I think kids are having their own ideas. It's changing there also.
Got it. Well, I like that. I think I've got 3 little ones. I'm thinking of trying that myself. I'm just going to see if that works. I'm going to give it a try.
I know.
So, where along the way did you decide oncology was going to be the route for you? What did that look like?
During my residency, we go through rotation of the oncology ward also. During my rotation, I was very fascinated by the oncology cases and what kind of difficulty patient and the family goes through, and if they become cancer free and if the treatments become very successful, the kind of happiness and the kind of gratitude they have the physician, and that kind of inspired me to go into oncology. And honestly, I was thinking between oncology and cardiology. And at the time of my application process, I was walking in the hallway and my oncology program director, Dr. Mills, fantastic person, he said, hey, Praveen, we have an opening here. Do you want to join? And for me, it's very hard to say no. So I said, okay, Dr. Mills, that's how I joined oncology.
Yeah.
And no regrets at all.
Yeah. So it seems to me like that started as fate was leading you there, but then over time it kind of became a calling, it seems.
Yes, it's a calling. Definitely, it's a calling.
Yeah. You said something that was interesting to me. It's actually one of the things I've been curious about is seeing the treatment. You were interested in oncology cases, and then seeing the success
Yes.
and the result of that
Yes.
is what really kind of piqued your interest. Can you talk a little bit more about that?
See, most of the time when there is a cancer diagnosis, it's kind of very scary diagnosis for the patient and the family. And a lot of times, depending on the stage of the cancer, there is a very good chance we can cure it, especially early stage cancers, we can completely cure it. And But the patient and the family doesn't know that at the time of diagnosis. Once we do the staging workup, if it is a stage 1, stage 2, at times stage 3, and when we say it's a stage 2 cancer, there is a very good chance we can beat the cancer, and they're so happy about it, and they go through the treatment. At the end of the treatment, we repeat the scans, and if there is no cancer, I mean, that gives immense happiness and pleasure for those people.
Mm-hmm. Man, that's powerful.
Oh yeah.
That leads into something I really wanted to pick your brain about a little bit is that I would think, and I could be wrong on this because I've never been an oncologist, but I would think it could be a heavy job or a heavy responsibility if you're seeing people at their most fearful, right? They're so scared. They're so, because when in our culture, I don't know what it's like everywhere, but I know in our culture, when the C word gets mentioned, you know, it's like the air leaves the room.
Yes,
you know, people
exactly.
just, you know, panic, understandably so.
Yeah.
And so that's where you're starting. You know,
Yes.
you're starting every conversation. If they're seeing you,
Yes. With the cancer.
there's cancer or suspicion of
cancer,
it. And
yes.
so what a heavy thing. And so what's interesting to me about you is, as long as I've known you, you have always been upbeat, positive, smiling, you know, and you've been doing it for 21 years.
As my practice, but the training together almost like 25 years.
25 years
Yeah.
of working with cancer, with oncology, and you're still positive, you're still smiling. To me, that is incredible, and it speaks to the heart that you have for this. So you answered it a little bit already, but I wanted to ask some more. Is how have you maintained that positivity through dealing with what I would, you know, call a lot of darkness maybe and heaviness, working with tough situations?
Yeah. It is definitely very difficult and challenging. I do have my own moments of fear and desperation and very scary things, but I built that emotional barrier. It won't affect me as a person. When I go to the patient's room, when I talk to them, I tell them exactly what it is and what I think I can do to make a difference in their lives. And when I leave the room, I carry their history and the pathology and the treatment plan, but I try not to carry the emotions. I have a clear wall built between the emotions and my job. I think that's the best way I can survive.
Yeah. You said that's profound. In a little bit of this, just through nursing, one of the things I tell new nurses, I'll be curious your thoughts on this. New nurses will sometimes ask about, I do a lot of, part of my role is I do a lot of training for new nurses and even new providers sometimes, but they'll ask me, how do I find that balance between caring and having compassion, but also being, you know, completely burnt out, I can't cry all day at my job. How do I do that?
Yeah.
So one of the phrases I've used, and I've tried to live this myself, is to be able to have compassion and see someone else's pain and empathize with that, but not take that pain on as my own pain.
Yes.
It sounds like that's kind of what you're saying. Is that
exactly? Yeah. You need to have compassion and empathize. Yes, right. Exactly.
But I can't carry that with me. When
you cannot carry that with me. You know, for example, about 7 years ago, my father was diagnosed with pancreatic cancer. Now, just imagine he was in India. I'm an oncologist here, and it's my father, my role model, my hero, and he had the pancreatic cancer. And how difficult for me as a son, as a physician, as a family member. It is tough, but I just told myself, I need to act like a physician, I need to have the clear barrier, and I need to do what I need to do for the best quality of life that I can provide for him. And I did that way.
Wow. And that allows you to think clearly, make the best decisions.
Yes, you need to be able to think clearly.
Yeah,
yes.
None of us make good decisions when we're emotional.
Yes.
At least I don't.
Yes, it is always tough.
So you're some of the things you're telling me is, and I sometimes think of cancer as like a hope stealer. Like somebody gets cancer, and everybody has either themselves or they know somebody, and as soon as that cancer word is brought up, it's like, you know, they're just feel scared and even hopeless sometimes.
Yes.
And so it sounds like you are, you know, kind of on the opposite end of that. That is fascinating to me. Is you're like, no, I'm the hope. I can bring some hope in the middle of this like horrible, you know, scary, situation.
Yes. Definitely when a patient comes, an elderly person, I tell them, you know, it's a scary diagnosis, but there is a light at the end of the tunnel. You'll have 4 months or 6 months of difficult time with the treatments, everything, but be optimistic and you can see the light at the end of the tunnel. You'll be able to attend your son's graduation, granddaughter's wedding, and you'll have family life back to you. Just bear with me for the next few months' time.
Okay, listen, I cry easy. You're getting me. You're talking about making vacations and things like that. I got little ones. So let me, and this is just me being selfish because this is interesting to me. I work with a lot of patients and I do a lot of training with providers and nurses, things like that. One of the things sometimes I think folks in healthcare struggle with is how do I balance being realistic and hope? Because I think some people think, well, if I don't want to give false hope, so I have to be very careful.
Exactly.
How do you do that?
I tell the patients very clearly my impression and my opinion from the time of diagnosis. I try not to sweet coat things and give any false hopes. I think it's best to be upfront and very honest with the patients. So even if it is a bad outcome, bad treatments and everything, they'll get mentally prepared and they'll get stronger. So you should be honest with the patient. You should tell the truth. Is going to be curable, not curable? What is the life expectancy? What is the prognosis? So if the prognosis is not good, you give them the options, what they can do to make their remaining part of their life better. Like they should not suffer. They should have a wonderful quality of life in the end of their life. Everybody should die in dignity. And I try to tell them a lot. That's part of the palliative care I'm also interested in. That's what we try to tell the patients and the families.
Yeah, I love that. I don't love the situation, but I love your philosophy for handling it. It sounds extremely healthy and positive.
Yeah,
here's what we
positive.
Can't do.
Yes.
But here's the things we can, and there's a lot. And so let me ask about that. It seems like, and this is not my world by any means, but it seems like our understanding and ability to treat cancer or in related diagnosis have come so far over the years.
Oh, so much of advancement, so much unbelievable advancements. Yes.
Yeah. What are some of the things, like maybe in the last 5 years, that have really just kind of been game changers?
Okay. To make it very simple, previously during my training, for example, there is a lung cancer. We used to treat like a lung cancer. But nowadays, we do what's called the biomarkers and genetic testing. And what kind of genetic mutations are attached to that cancer, we treat that specific mutation. And to go much further, nowadays, depending on the kind of mutation, we treat the patient rather than the site of origination. There's so much of advancement in the genetics and the targeted therapies and the precision medicine. Oh, unbelievable advancement. From the time of my training to now, in the 20 years, oh my goodness, it is unbelievable growth.
Yeah, it seems that way. You know, it seems like it's come so far. What are it seems, in a little bit that I know, we have a lot to be hopeful for moving forward with cancer. What are some of the things that you're excited about that are coming?
There are so many new drugs in the pipeline. Pretty much, if you blink your eye, you'll miss a drug. There is, I don't think a week goes by without having a new drug approved by FDA. And these drugs are a lot less complications, lot less side effects, easily tolerable for the patient. And of course, they're expensive because they're all the new drugs and they're increasing their life expectancy significantly. There is always a good chance of cure. I mean, like, it is humongous development and so much of positiveness for the cancer treatments and the patients and their families.
Yeah. So would it be accurate to say a cancer diagnosis right now is not what it used to be?
No, it's not a death sentence. No, absolutely not. No.
I love that.
Yeah. Even a stage 4 cancer, for example, 20 years ago, stage 4 lung cancer, we used to say maybe 10 to 12 months, pretty maximum. Nowadays, I have patients like 5 years, 6 years, 7 years. In this time, they can attend their granddaughter's wedding and a grandson's graduation, and they can accomplish so many of their family things that makes them happy.
Yeah. Wow, man.
Yeah.
Hope that sounds pretty hopeful to me.
Yes, it is very hopeful, and it will continue to get better than anything else.
Yeah.
Yeah.
What do you think are the big, the misconceptions that people have? If you could wave your magic wand and get rid of some myths and misconceptions, what would that be?
A couple of common misconceptions patients always bring it to my attention is, if they do the biopsy, cancer will spread.
Okay.
That's once for the biopsy, they open the tissue or abdomen or a lung and they get a biopsy. They say, oh, it can spread. That it doesn't. That's not true. It doesn't spread, and you need to have the biopsy to get the diagnosis.
Yeah.
So I try to convince a lot of my patients.
Sure.
And
so is there some research around that? Because I can see the logic of, hey, I've got this.
You open it and it spreads.
And you poke a hole in it or a bunch of holes in it, it spreads. How's that been debunked?
No, you need to get the tissue diagnosis.
Sure.
Cancer doesn't spread by the air. It will spread through the lymphatic system or through the blood system.
Okay.
When you do the biopsy, just go and poke a needle and take a small tissue out of it. That's it. It's not like an airborne disease.
Yeah. Okay.
So it doesn't spread that way.
Got it.
And the second common myth is sugars. People say that if you eat sugar, it will grow the cancer.
I've heard that.
That is not, it's not scientifically proven.
Right.
I tell my patients while on the treatments, enjoy eating whatever you like to eat. Only thing is keep it clean, cook it properly, wash it properly, and don't eat any raw food like a sushi, something like that one. But enjoy the food what you like to enjoy.
Yeah.
No restrictions.
I like that message. I like that one a lot. That's awesome. Yeah. Is there anything that you would like for people in the community to know, things that they can be doing preventatively? That again, if you could wave your magic wand and get everybody on Dr. Reddy's program, what would that look like?
I recommend all the community members to have the family physicians. They need to go and see them on the yearly health checkup or one of those things, and get the screening procedures like mammograms, colonoscopies, screening CT scans for the lung cancer, screening digital rectal exam and PSA, colonoscopies, and all these preventive measures are very important. That way we'll be able to diagnose the cancer early, and early stage cancers are curable. So there is a chance we can detect early and cure them early, so they will have a much better life and pretty much normal lifespans. Yeah, be proactive. Especially in the medical field, we try to ignore a lot, physicians and the nursing staff. No, it's very important to have the regular doctor, and I know we are medical field, we are physicians and nurses, but you need to go to somebody and let them take care of you.
Oh, absolutely. It's like an old trope in, nurses won't go. Nurses are the worst patients, and doctors too. Like they're terrible patients.
Medical professionals are bad.
No doubt about it. So the early screening is key.
Very important. Very important.
And I know we've done a lot at United Regional to promote that in the community. With the we're sending out reminders and messages when you hit a certain age and certain benchmarks. We're reminding you and trying to get in front of that. And I personally know some people whose lives have been saved, from preventative screening.
Oh yeah, definitely. Yeah. And in fact, October is a breast cancer month, and I think we'll be advising the community members to get the mammograms and self-examination of the breast, and following with your gynecologist or the family physician to get the screening position a lot. We'll do a lot of promotion for those things.
Absolutely. So I'll tell you right now, if I needed services, you'd be who I'd be looking for. You have just a great reputation in the community amongst the healthcare team and patients as well. Where can we find you at these days?
We're at the Cancer Center. It's 1600 10th Street. Across the helipad, that where the helicopter lands, the next building next to that one. Okay. And I think it should be on our hospital website also. You can, I think, easy to find. I think maybe Google also gives a phone number to call the office too. Yeah.
Excellent. Well, is there anything that we haven't talked about today that's kind of burning in your heart that you'd like for folks to know about you or about the work that you're doing?
See, I came to this community 21 years ago. When I came, my daughter was 1 year old, and I had my son here. Both my kids, I raised in this community, and this community has given so much to me. I don't think I can never repay to the community. So whatever the service I provide to my patients and my fellow community members is my giving it back to the community. I thank the community immensely, and I'm grateful that wonderful community, and I'm so happy to be here.
Yeah, that comes across anytime anybody visits with you or anybody that knows you. It certainly comes across that's your heart. And one last thing, and I ask this to everybody, and
please.
if you don't have an answer, it's okay, but what's something that you could tell tell me about you that not everybody maybe that works at United Regional or works at the clinic knows? Is there any fun facts that we don't know about you?
Well, I like cricket.
Okay.
Cricket is a game almost they pay for 5 days, and during the process they have the tea break, drinks break, lunch break. So I'll be watching in the middle of the night also. I'll get up in the middle of the night.
to keep up with your...
I put my alarm to get up to watch the games.
I love it. That's a diehard fan right there.
That's how I grew up, and that's one my entertainment or relaxation.
Fantastic. Fantastic. I love it. Well, it's been an absolute honor visiting with you. Thank you for coming on the
Thank you, Ryan.
podcast.
My pleasure anytime, Ryan. Thank you.